Nurses and midwives have for ages been frontline soldiers in the fight against sickness and generally ill health. But the period of COVID-19 has been one to prove their sincerity and commitment to the service of humanity.
I didn't hate my job. I know it's a career. I was called to serve people. We didn't say we would not serve for such a kind of a disease. We prayed that any disease we are going to treat, or any client we are going to help.
As a nurse in general, we vow to take care of the patients, irrespective of the condition. So the first and foremost step, I had to prepare myself. From the 2nd February 2020, when it was declared that COVID-19 is a global pandemic. So I had interest to study the waves, to study the disease process and other crucial elements in relation to COVID-19. So by the time when we had the first case in Malawi, I was almost psychologically prepared that at one point in time, if it's not my relative, it might be any patient that I will nurse one day suffering from COVID-19. So when I was allocated to work in the isolation ward, it was, yes, hard, but at least I easily had to accept, because already in my mind I got prepared.
The landing of the virus on the shores of Africa, all the way from the Wuhan city of China, sent a chilling wave of fear through the spines of the residents of the continent. The news of the first recorded case of the virus in Lilongwezi Area 9 spread like wildfire across Malawi and made everyone even the more afraid. Nurses as humans were not spared from fear, as they too are not immune to infection.
Considering the first wave, receiving a message that you have COVID, it was more like a death sentence.
Everyone was afraid. Even myself, I was afraid.
Harriet Kiomba, the acting executive director of the National Organization of Nurses and Midwives of Malawi, was among those in the forefront, cheering and counseling the nurses who tested positive to COVID-19.
When the virus got into this country, Malawi, our nurses and midwives nationwide were also fearful, and of course most of them indeed lost hope when they were tested positive, and it took people to give support and words of wisdom to restore back that hope.
But theirs is a calling and not just a profession.
I, as a health worker, as a provider too, because I know that there are patients I have to care for, I had to accept to go into isolation to care for the patient. But inside me, I had fear, knowing that the patient that I am caring for is for COVID-19. So I also thought of maybe I'll get the pandemic.
Thinking of what if I'll be the one who will be sick one day, who is going to take care of me. So I decided to volunteer myself to work in COVID ward.
Forgetting self for the sake of others, they went out to meet the deadly enemy face to face, their only motivation being to see their patients walking out of isolation centers as the iron fetters of COVID-19 fell to the ground.
When patients are being discharged from the COVID ward, you could feel the joy on the patient as well as the nurse that were taking care of that patient, because previously everyone was associating COVID-19 with death. So if people are being discharged, you could see them saying thank you, being overjoyous that they are going out of the COVID ward. So that only made me realize that nurses are very important, because we are there 24/7 providing care without guardians going inside the treatment unit. So you could do everything for the patient. So I had the feeling of total nursing care, because you could do everything to the on the patient. You could provide bed bath, which is physical. You could provide mental. giving hope to the patient. You could provide spiritual care. Sometimes those people were alone and they were afraid. So spiritual care could provide some hope to the patients, and as well as social. You are the one who was there. You could crack jokes with them. So that only made me experience total nursing care to the patients, because most of the times you just tell the guardians maybe to do some of the duties as you only doing, maybe giving drugs, or maybe sometimes when you have time you do bed making. But these things were done in COVID ward holistically to the patients.
As an organization whose mandate is to look after the welfare and professional and socio-economic interests of nurses, NORM engaged the government, raising a number of its expectations in regard to COVID-19 as related to the work of nurses and midwives.
Yeah, we continued as an organization on its own, as well as through the Human Resource for Health Coalition, to lobby and advocate firstly for the healthcare workers to be trained. Remember, this is a new disease, a pandemic, where each one of us were actually completely blank of the cause and what to do next. So as the whole community, the population of Malawi was fearful, the healthcare workers too were fearful. They needed to know what steps to take next, and that's why we called government to train our nurses and of course other healthcare workers, so that they are aware of how they were going to protect themselves firstly, and about the signs and symptoms, and of course how they were going to care about the community or the population of Malawi. So firstly, we lobbied government to train our healthcare workers. Again, we lobbied for the government to provide protective wear, masks inclusive, and other suppliers, not only for nurses and midwives, but for the healthcare fraternity, healthcare worker fraternity, as well as provision of risk allowance. Remember, this is a disease which is highly infectious, and it required that soldiers only go ahead to provide treatment, care and support. And so we lobbied government to provide the risk allowances on top of the protective wear. And of course, we thank God that government did provide the resources during the high peaks of the pandemic, and they continued to support the healthcare workers with, of course, the lunch allowances and risk allowances. So we are so much thankful to government to give us a listening ear.
Some of these nurses who put their lives at such a risk had families that they worried about or that worried about them.
When my family members learned about my situation, when I told them I have tested positive, and looking at the way I was struggling to breathe, the way I was coughing, they were very much afraid. And maybe they thought I was dying, because I could see that they were all upset, they were all stressed up, so they were afraid, but they took very good care of me when I was suffering.
The family members were so shocked, and they could say, maybe don't go again to the testing area. You'll see now you have been infected. So if you are healed, don't go back to the tent. Even though I was infected, but after I was treated and I was fine, I came back to work, and I continued working with the COVID patients or maybe attending to people who need the services of COVID.
In some instances, whole families ended up being infected. Linley Muhanda from Zimba South District Hospital shares her story.
After I got the virus, after the testing, they started cancelling me. They cancelled me. So I'm a health worker, but I'm a human being. I've already said it wasn't easy, but after the cancelling, I had to accept and move on. And from there, they had to trace my family members, and they called for them all to test them, and they were all tested. Unfortunately, my husband and all the kids were also tested positive. Even a very little kid that I have, a year-old one, was also positive. And as a mother, it was so stressful and traumatizing when I got the news. And it was very hard for them to accept the news. But after the counselings, because after testing positive, they were also cancelled. And after the counselling, at least the only choice that they had was to accept the news, and they accepted the news. And as a mother, I also took the role of counseling my family members to accept the news and move on.
But the disease of forgetting too quickly or letting the goodness of others be blown away too easily has not spared some Malawians. Despite such a wonderful service of love to humanity, some nurses have themselves faced the bitter odds from the very people they serve.
Being the new disease in the country, there were a lot of news, false news. So even health workers at a certain point in time, even our neighbors could fear to chat with us. Kids from the neighbors would fear to play with our kids, and so forth and so on.
The community was much scared of the health workers because most of the people in the community believe that the virus was being spread much more in the public hospitals. So the communities could prefer going to the private clinics where there were no congestion, and even in the public transport for a nurse or any other health worker who is known that is a health worker. It was very difficult to travel through the public transport because they would even not allow you to board a bus.
But they were determined that their service to humanity should not cease even amidst such hostile circumstances. So they had to find a way to still make things work.
We came up with the decision of not putting on uniform. So we were taking our uniforms in the bags and put them when we were at work. And after finishing work, we leave them at the facility, or else we take them in the bag so that the community should not know that we are health workers.
It was difficult from the community to understand it because they do suggest that it was just a plan from our hospital that one can just say, I'm COVID-19 positive, so that he or he gets something like monetary issues, not knowing that it was real.
Unfortunately, it was not only the community who gave the nurses who worked in isolation wards a tough time.
It wasn't easy. Not only the community outside there, but even here at Queen's, you could meet your fellow staff. When they know that you're working in COVID ward, they could run away from you saying, you have COVID because you're working in COVID ward. Maybe in the community, people would not know that you are working in COVID ward because you cannot disclose yourself to the community that I'm working in COVID ward, because you knew that this COVID-19, everyone is fear of this COVID-19. So if you tell people that I'm working in COVID ward, you will make them run away from you because they will feel that because you're working in COVID ward, then you have COVID. But the experience that I had, even with my co-workers, he or she would ask you that where are you working, or just knowing that you're working in COVID ward, they would say, no, don't come near me. Someone even refused me a lift, saying you can't come in because you work in COVID ward. So it was even from us within, because you're working in COVID ward, people were just associating you as the COVID itself. not knowing that when you are there, you have full PPE, that you're protecting yourself from the COVID.
But long at last, people were able to accept after hearing the real facts about the disease.
At face value, one would expect someone who works in the hospital and a frontliner for that matter to have all the care at their disposal. Unfortunately, it was not always like that. Those who got the virus themselves share various experiences.
Starting from the diagnosis itself, I started having the signs and symptoms of COVID-19. Should be a week prior to my testing. After having those signs and symptoms, that was cough, fever, general body pains, sore throat. I tried to go for a test at Gameza, but unfortunately, I went there almost twice. I was told that they did not have test kits in place. So to me, it was hard for me to access the testing itself. Being a frontline, I think that was not good. It was until the other week when I went there, and I was lucky enough that I came across one of my old friends who noticed me and gave me an opportunity to go for the test. Now, after being given my result, another bad thing happened again, because I was just told that you are positive. However, the facility has now medications to give me, so I was just sent home without any medications.
A story is told of a nurse who had to struggle to get tested. The persons responsible denied testing her because she was not a contact of people who were COVID positive.
It was during the weekend that I started feeling signs and symptoms of COVID. More especially headache. I was having severe headache. By then my blood pressure was normal, but I was having migraine headache. On Monday, I met the one who was working in the testing center to ask him if he could do the test on me. He said because I was not a contact, he could not test me. So he sent me back. After 2 days, I went there again on Wednesday. I was told the same thing. I went back. The following morning, I insisted that I be tested. So they agreed that I should be tested, but I was not having any contacts of COVID-19 by then, I thought.
But when she finally found her way through and got tested, she was found to be positive. Thanks to her persistence, she probably might have never known her condition and perhaps would die just like that.
I think we as health workers, we have to understand each other, and we have to be attended to when it is due, because we work with patients, we work with clients, and some of the guardians that may be COVID positive, but we don't know. Maybe you attend to a patient, you send him to the COVID testing center, they don't come back for feedback. Whether they are positive or not, we don't even know. So that puts us at a higher risk of contracting the disease without knowing. So at least because most of us as health workers, we know the signs and symptoms of COVID. I think we should be the first ones to be tested if we want to.
Apparently, there should have been something better for these people.
As we all know, COVID-19, everyone was infected or affected. So, as health workers, what we expect is if we are to manage a patient, of course, some they are calling cases, but to us, they are patients, they are human beings. We need to save their lives. So, the first and foremost, we need to get prepared that we are going to save this patient who is having a disease of which most of people they are afraid of. So what I'm trying to drive at is that if we might need some support that is required to these health workers, please, in such situations, it's high time that our leaders at all levels should consider as a priority to support these health workers, so that when they're going to nurse or manage this patient, psychologically, at least in terms of that dimension, they should be prepared.
Okay, I think it should start with testing itself. We should have good access to testing services so that we should not struggle to go for the testing, because if it's hard for you to go for a test, it means you are delaying treatment. So what if I had died before getting the test? The second thing should be, at least the medications should be there. If not maybe for everyone, but for us maybe it should be there, because we are frontliners. Because if we die, all of us, who is going to take care of the people? So I think priority itself has to be there. The other issue should be a good follow-up. There wasn't that follow-up. Of course, I should not just condemn it completely. I should accept that my designated nursing officer was trying to check on me. My nursing in charge was trying to check on me for a couple of times, as well as some officials from now, only phone calls. Yeah, but I think if they can improve on such areas, that could have been much better.
Catching COVID-19, it is very difficult. It is a very difficult situation or experience, because as you can see, when you are isolated from the family members, there is a lot of stress. And one of the major challenges that contributed to most of the deaths from COVID-19, it was isolation, because you could feel that there's nothing I can do, I'm being separated from my friends, I'm being separated from my family, so you could think that I'm gone. Yeah, what is being needed more is psychological support from family members, from fellow health workers, from even church members, as it was with me. I could have more support from my church pastor, my fellow church members, yeah, more support from my fellow health workers, even from my bosses. They could be calling me, giving me support, psychological support. I could feel that I'm somebody. People are really with me.
We had to counsel about 35 of them here at the organization. Of course, it was through the WhatsApp group, or calling one by one, and eventually we formed a WhatsApp group for continued peer counseling and support.
By looking at the global trends, it is very likely that Malawi may experience additional waves of COVID-19, just like how it is happening in other countries across the globe.
We still continue to lobby and calling upon government to say, see, now there is this fourth wave. We would want government again to ensure that the resources are available, are adequate, and that our frontliners, the healthcare workers, in particular nurses and midwives, of course, are provided with enough resources, and maybe, of course, the training on updates, because this is, I think, a new strain which which have new information, because there are new discoveries because of the virus that mutates continuously.
And what about the issue of risk allowances?
Yeah, so we are, as a union, aware that risk allowances are not exempted from pay as you earn. However, we would want government to consider either increasing or advising us to apply for an exemption on the same to the responsible ministry, and that is the Ministry of Finance. So we are indeed calling upon government to make sure that the risk allowance should be tax-free.